Ambulance crews are becoming extremely limited in rural areas. In some places, the results could be nobody responding to a 911 call.
As Lucy Kafanov reports, more than 1/3 of all rural EMS are in danger of closing after the pandemic stretched resources and funding even more.
With its rugged terrain and wide open spaces, Wyoming is still the wild frontier. That's the draw of places like Washakie County. The trade-off? The nearest major trauma hospital is more than 2.5 hours away. For rural residents, access to emergency medical services, paramedics, and an ambulance can mean, well, everything.
Is this a life or death issue?
Absolutely.
Luke Seifert has spent the past 3 years running Washakie County's volunteer ambulance service, a literal lifeline for some 8,000 residents. But as of this month, the volunteer service is no more.
We just saw that we didn't have the personnel to continue.
A nearby hospital system, Cody Regional Health, has agreed to provide ambulance coverage, averting a crisis in this county. But it's a problem playing out across rural America. Ambulance crews are running out of money and volunteers.
Majority of your ambulance service are not paid. So if you don't have your volunteers, you can't run calls. There's simply just not enough volumes to keep ambulance service afloat. In the state of Wyoming, EMS is not essential. So that means there's nobody responsible to fund these entities.
Unlike police and fire, less than 10 states require EMS as an essential service, pushing some rural ambulances to the brink of economic collapse. Health experts now warn more than 1/3 of all rural EMS are in danger of closing.
It's a crisis in rural America right now.
Yeah, today. Yeah, this isn't something that's in the future. It is happening now.
According to Seifert, the funding model for EMS is fundamentally flawed.
You're reimbursed based on the number of patients that you transport to a hospital. So you could get called 1,000 times a year and only transport 750 patients. Those other 250 calls, you made no money on.
When you look at what's happening here, it's just the tip of the iceberg. There's other services throughout the state that are just, one bad year away from closure.
Wyoming may have the smallest population in America, but when it comes to land, the cowboy state is the 9th largest.
Fremont County is roughly the size of the state of Vermont, but the private company providing ambulance services here says it can't afford to keep going after losing $1.5 million in revenue last year. The company, American Medical Response, announced it won't renew its contract when it runs out on June 30th. No others have bid.
Because of the distance and the ruralness of this county, we just don't have people standing in line wanting to provide ambulance service.
Fremont County Commissioner Larry Allen is scrambling to find a solution.
What keeps you up at night?
I worry about not providing a quick service, a quick response.
I think if we didn't have access to ambulances, death rate would be higher.
The Wind River Indian Reservation relies on Fremont County for ambulances.
A lot of our tribal members don't have working vehicles, or they don't have direct access to take themselves to the hospital or the clinic. So it's a matter of life and death, essentially, for us.
In parts of rural America, the system that was built to save lives is now itself in need of saving. Lucy Kafanov, CNN, Fremont County, Wyoming.
Two schools meeting in two different sports at the same place and same time tonight. Devin Fry brings us scores from the region championships next.